Hello, my name is Jamie. I'm one of the physiotherapists at Response. And today our video is based on sports injuries. And we've got a special guest with us, and I'll let him introduce himself.
Hi, my name's Dean Conway. I'm the founder and director with CRX Compression. It's a compression products company, born out of 30 years pretty much in elite sport physiotherapists. And we've combined with Response to look at using our products in combination with these guys from a clinical point of view.
So when we think about sporting injuries, we're thinking about any particular injury or pain that can be occurred during a sporting activity, whether that be exercise or other sort of physical activity. What we're going to be thinking about particularly is either muscles, joints, ligaments, or bony injuries. And that can be strains, sprains, fractures, dislocations, quite a broad variety of different things that can be going on. Usually they're going to occur fairly acute and you'll notice it pretty quickly. And those sort of symptoms can sometimes be anywhere the range of pain, stiffness, swelling, reduced range of movement and reduced function.
I think at CRX Compression, our main input clinically, I suppose, is along the lines of RICE, which everyone's aware of. Rest, ice, compression, elevation for sort of early treatment. You know, from kids' injuries through to serious sports injuries, it doesn't vary a huge amount. But the compression element of that is often sort of overlooked, you know, ahead of maybe a bag of peas or a bag of ice, which is definitely the way to go. You do need to ice damaged tissue, but I believe strongly that that compression element is as important, if not more important, in controlling edema. And basically the aim of our compression products in sports injuries is to reduce edema, reduce pain on the back of edema reduction and improve function. I think, as Jamie's touched on, that's really what our main aim as physios is really in approaching sports injuries.
So with any sporting injury, it's really advisable to get it checked by one of our physios here at Response, because any injury that you have during sport can take either days, weeks or months to recover. And sometimes if you're unsure whether it's safe to return, having a professional's advice is really, really important for that.
I think the key aim for us as physiotherapists with sports injuries is trying to find exactly what the injury is. Obviously we've got other tools, diagnostics to help us with that diagnostic confirmation, but essentially you know, we manage the presenting sort of symptoms at each session essentially to plan progress from there. So if the clinical symptoms allow, they can begin their progressions. For example, an ACL beginning back to weight bearing, back to jogging, back to running. At each of those stages they're going to get normal reaction of more edema because they're stressed in areas they haven't stressed for a while. So again, it goes back to the basics of controlling that edema at stages of progression in simple rehab. From a frozen shoulder that's going to be 10 days to a couple of weeks, to a grade 2 ciliate tear, which will be 8 weeks, to an ACL repair, which is 6 months. So at each stage there, it's important to go back to basics from a RICE point of view, and in particular from our point of view, from a compression point of view. So
if we have a muscle strain, for example, whilst we're playing football, we might feel quite a deep, sharp and immediate pain, and say we have that in our calf. That potentially might suggest that we've irritated some of the muscles or torn some of the muscles around that structure. And what you're going to get initially is an inflammatory phase, where you get a lot of swelling, pain, reduced sort of movement and stiffness and loss of function essentially. So that's where compression can come really helpful to try and reduce that sort of level and improve the compression to reduce the swelling.
I think it's important as well to say, with that type of injury and with any elite sport or you know, normal people injuries, desk jobs and stuff, those injuries still need to proceed back to full fitness slowly and almost at a ladder type approach, rather than a lot of people sort of feel really good, 100% fit, walking around, and they feel fine at their desk job, and then go back to playing squash or you know, five-a-side football, and it's too much, it's too soon. So you have to have a graded rehabilitation plan going back as well, not just treatment. You have to strengthen that muscle up to the level it was before it went, otherwise it's going to go again. So recurrence is a big issue. I mean, obviously we think compression helps with that. but it doesn't help if you don't do the strength work yourself and don't have a graded return to, be it social squash, social football, elite cricket, elite rugby, whatever.
So taking a calf strain, for example, the next few videos are a quick return to play advice and guidance and a few exercises. That's going to help you safely return to the sport and reduce your risk of further injury.
So in summary, I think we've touched on pretty much everything we need to there, but just to be aware, you need to seek attention if you've got an injury, if you've got pain. Make sure it's looked at properly initially, get the correct diagnosis and get a plan for rehabilitation and recovery. We strongly believe in the RICE philosophies. It's been around for 100 years, rest, ice, compression, elevation. You still apply those. You also apply those at stages of rehabilitation, whether it's as Jamie said, from a calf injury or from an ACL repair. You must go back to basics at each time that you stress that injury back to normal. And the biggest risk we see of recurrence is people not doing enough rehab and strength work before going back to, as you said, whether it's social squash, football, elite rugby, cricket. You need to strengthen that area back to where it was and even stronger before it torn, or you've got a good chance of it going again and actually being from a grade 1 to a grade 2 tear, probably going along from a grade 2 to a grade 3 and possibly missing months. So really important not to rush back to sport. Once you feel okay, make sure you've done your strength work and then you should be fine from that point of view.
So if you've had a sporting injury and would like a good diagnosis, some advice and exercise progressions to get you back into playing sport as quickly as possible, please come and see one of our physios at Response Physio. If you've liked our video today, please go and like and subscribe to our YouTube page, where we're going to have very sort of regular, up-to-date YouTube videos on different areas and topics each month. Please have a look. Thank you. Bye for now.